Let's talk about something that should keep every AI leader up at night. It's this idea of an ethical blind spot, a hidden risk that can be hiding behind what looks like your best, most successful model. We're going to dig into why the very numbers that give you confidence might actually be masking a total disaster.
So just imagine this for a second. Your team has been working for months on a critical new healthcare model. The validation results finally come in, and you see it, an AUC of 0.88. Whew, that feels good, right? That's a solid number. You're probably already thinking about the deployment plan. But what if I told you that single number, that beautiful 0.88, is hiding a catastrophic safety failure? Okay, here's another number for you, 63%. It's not an AUC score, it's not precision. So, what is it? That 63%, that was the actual real-world sensitivity of a sepsis AI model that was deployed in hospitals all over the place. Now, sensitivity just means its ability to correctly spot patients who have the condition. So despite all its great internal metrics, it was failing to identify nearly 1 out of every 3 sepsis cases. This wasn't some theoretical edge case. This was a disaster hiding in plain sight. The case I'm talking about is the epic sepsis model controversy. And really, it's a story that serves as a huge cautionary tale for anyone, and I mean anyone, building and deploying AI today. Let's really break down what went wrong here.
So, the epic sepsis model, or ESM, this thing was a big deal. It was integrated into the electronic health record systems used by hundreds and hundreds of hospitals. It was designed to do one thing, save lives by catching sepsis early. But then, a major study in 2021, published in JAMA, decided to take a look under the hood. And what they found, well, it was shocking. The failures just cascaded. It was a total domino effect. First, there was no real external validation, which meant the model just didn't work well when it was put into new hospitals. Then, because no one was monitoring it after deployment, this massive failure went completely unnoticed. This led to an insane 166 false alarms for every single true sepsis case. Can you imagine being a doctor dealing with that? It caused this massive alert fatigue, and in the end, the model wasn't just failing to help, it was actively destroying trust in AI. So how on earth does a failure this big happen? Well, it starts with something I like to call the aggregate metric trap. It's this incredibly dangerous habit of relying on one single high-level number to tell you the entire story. And this is really the heart of the problem, right? A single score, like an overall AUC, averages out the performance across all these different groups of people. It creates this smooth, shiny, reassuring surface that completely hides all the deep, dangerous cracks underneath. This is what we usually see. This is what leaders and executives look at. It's a dashboard with one beautiful high-level number, an overall AUC of 0.88. It looks amazing. It feels like a win. It justifies the project and pushes the model right into production. But what are we not seeing? But then, when we pull back the curtain and actually break down the data by group, the story completely changes. You see, the model works great for Group A. It works pretty well for Group B. But for Group C, its performance is awful. An AUC of just 0.73. That fantastic overall score was completely masking a catastrophic failure for an entire subgroup of people. And look, this isn't just some abstract idea that happens during validation. This exact problem is happening right now, silently, at scale, inside our automated MLOps pipelines every single day. Let me show you what I mean. Imagine you've got an automated retraining pipeline. The system's only rule for deployment is simple. AUC must be greater than 0.85. So, week after week, the model retrains on new data, it passes that check, and it gets deployed. On the surface, the overall performance looks totally stable. But what the system isn't watching is fairness. Silently, behind the scenes, the model's performance for one demographic group is tanking. The gap in care between groups has quadrupled, from 3% to 12%. The automated system, which was built for efficiency, has now automated inequity. Okay, so if we know that a single score is a trap, how do we escape it? Well, we have to move beyond this super narrow view and start using a framework for what I call comprehensive validation. So what is comprehensive validation? It means treating your model evaluation like a really rigorous diagnostic exam, not just a simple pass-fail test. We have to look at performance from every possible critical angle. And this isn't some optional nice-to-have for ethical AI. No, it is the absolute non-negotiable foundation of it. So here's what that can look like in the real world. This validation checklist is a fantastic place to start. Of course, you track your overall performance, your AUC, your precision, but you must also measure subgroup performance. You have to break down metrics like sensitivity for every single relevant demographic group. You have to define and track specific fairness criteria, like the equal opportunity gap, to make sure the model works equally well for everyone. And, so importantly, you have to measure operational utility. What's the false alarm rate? Are people in the field constantly overriding the system? Because a model can be statistically perfect and at the same time, completely useless in practice.
All of this brings us to a new standard of rigor. You see, building AI that we can actually trust isn't just about writing better algorithms. It's about a fundamental shift in how we define what success even looks like. So, to put it all together, we really need to internalize these principles. External validation on diverse, real-world data, it's not optional. Continuously monitoring all the key metrics, especially fairness and how it's used, is mandatory. We have to always break down our results by subgroup. We have to work with the people who will actually use the model to optimize for real-world impact, not just some statistical fantasy. And we have to be transparent about our model's performance, the good, the bad, and the ugly. I love this quote because it just perfectly captures the mindset shift that we all need. Launching a model isn't crossing the finish line. It's stepping up to the starting line of a long-term commitment, a commitment to monitoring, to maintenance, and to responsibility. And so I'll leave you with this one question to think about. Take a really hard look at your own projects, your own pipelines. Is your validation process just a box-checking exercise designed to confirm that you succeeded? Or is it a rigorous, skeptical process designed to find every possible failure point and ultimately to prevent real-world harm? The way we answer that question will define the future of trustworthy AI.